Lee checked the patient's chart before entering the room. She read it twice. The name, the medication, the notes from the previous shift. Her handwriting in the margin was small and neat. She clipped the chart back on the board, adjusted her badge, and pushed open the door. The patient was an older man. He was sitting up in bed, looking at the window. When Lee came in, he turned and smiled. She smiled back. She set her tray down on the side table and began checking the IV line. Her movements were careful and practiced. This part she knew how to do in any language. Then he asked her something. Lee heard the words, but they arrived too fast, in a shape she couldn't hold. She looked at him. He was still smiling. It was a friendly question. She could tell that much. Her heart moved up slightly in her chest, the way it did when English came her unexpectedly. She kept her hands on the ivy line so they would have something to do. She took one breath, slow and quiet. She did not want him to see the pause, but the pause was there. She had worked in this hospital for 5 months. Her medical English was good. She knew the words for symptoms and medications and procedures. But conversation English, the kind that had no fixed form, still caught her sometimes, especially in the morning, especially when she wasn't ready. Sorry, she said. Can you say again, please? He nodded and repeated himself, more slowly this time. I was asking, did you come from far? For work, I mean? Lee understood. She adjusted the ivy line and looked at him. Yes, she said, I come from China. She paused. I came. I came from China. She corrected herself quietly, without apology. I am here 2 years now. He nodded. Long way, he said. Yes, she said, long way. She wrote something on the chart. Her pen moved steadily. She had said what she meant. The grammar was almost right. Almost was enough. Then he asked her something else, longer this time, with a word in the middle she didn't catch. She wrote the last number on the chart and looked up. She had heard, my daughter something also, and then the unclear word, and then medicine. She wasn't sure if it was a question or a story. She waited one moment to see if more would come. It didn't. Sorry, she said again. I don't understand one word. Your daughter? She's a doctor? Nurse? He shook his head. Pharmacist. Ah, Lee wrote the word quietly in the corner of her notepad. Not the patient's chart, her own small notepad that she kept in her coat pocket. Pharmacist. That is good, she said. Important job. He seemed pleased. He said something about a university, about being proud. Lee caught most of it. She noted where nodding made sense. When she wasn't sure, she listened for the feeling behind the words. And the feeling was clear. He was a father who was proud of his daughter. That part didn't need translation. She solved it the way she solved most things she didn't fully understand. She listened for what was certain and let the rest be. She didn't pretend to understand the parts she missed. She didn't fill the silence with noise. She just stayed present and responded to what she knew, and let that be enough. Before she left the room, she checked the IV one more time. Everything is good, she said. I come back later. She picked up her tray. At the door, she turned. Your daughter, pharmacist, I learned this word today. The man laughed. A short, warm sound. Happy to help, he said. In the elevator going down, Lee took out her notepad. Pharmacist. She looked at it for a moment, then put the notepad back in her pocket. The elevator opened on the second floor, and she walked back into the corridor, past the nurse's station, past the window that looked out onto the car park and the gray morning sky. She had one more patient before her break. She already knew what she would do if she didn't understand something. She would say, Sorry, can you say again? She had said it twice today. It had worked twice. That was the kind of math she was learning to trust. Hello, everyone. I am Nadir. I hope today's story encouraged you to learn English often. See you next time. Bye.